Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time.
Hello and welcome to the Brain People Podcast. My name is Jonathan Edens. I'm a psychiatric PA, and I will be your host today for this very exciting topic. With me, I am joined by
Dr. Daniel Binus, and I'm a psychiatrist.
And so that exciting topic that I was just referring to, we're actually talking about one of the most basic, but probably a little bit more complex than I think all of us realize, is that of the breath. So,
Yes.
Dr. Binus, why are we covering the breath today? It seems a little bit odd on a mental health podcast to be covering breathing. And it's something that we all inherently know how to do, right?
We would hope so. Otherwise, we wouldn't be alive. But it's amazing the amount of research that's been done over recent years that has shown the importance of proper breathing when it comes to optimal physical and also mental health. And it has a tremendous impact. And even in recent months, as I've studied out this topic, I've noticed that changing the way I breathe really does have an effect on myself mentally and physical and all of this. And so I'm really happy to be able to share all this, maybe not all of it, but some of the highlights of what I've researched here with you today.
Awesome. Well, I know I am, and I'm sure our audience is looking forward to hearing about it. So I know you had a story to tell us about an influential person in the field of breathing research or whatnot. So why don't you go ahead and share?
This is an interesting historical anecdote. So there was a guy named George Catlin back in the 1830s, and initially he was a lawyer, but he got bored of that. So he started to be an artist, and they got bored of that. And so then he decided, you know what, I'm going to be an explorer. Now, back in the 1800s, there was a lot of amazing things in America to explore. Of course, you think about the Wild West and all of that. He took off, went into the plains, the Great Plains of America, and he was really one of the only individuals in history to really write down an accurate record of the Plains Indians tribes of that time. And it was very interesting because really this was, I don't know if you'd say at the height of their splendid culture, but it was definitely, they had an amazing culture, the Plains Indians back then. And he observed 50 tribes. And what he saw was very surprising to him at the time because, back then, the picture that a lot of the settlers had were that, the Indians were savages and maybe unhealthy or what have you. But he actually saw that many of these American Indians were tall. They had broad shoulders and barrel chests. They had straight teeth. And there was very little sickness among these tribes. And so he was curious, what was the secret of that? And what he eventually decided is that, the great secret of life and of success in their health was proper breathing techniques. And in the end, he actually wrote a book called Breath, and he shared how a lot of these Native American mothers would literally watch their babies even while they were sleeping, and if their mouths started opening, they would close their mouths to make sure that they would have proper breathing techniques, and oftentimes they would even hesitate to smile and what have you because they were so interested in making sure that they were breathing properly, and that seemed to be a big part of the secret of their health.
That's really fascinating that he would zero in on that particular thing being so different than that of his modern culture of the time.
Yeah, it is fascinating. I think it was kind of a twofold. I haven't read his book, but I read about the book, and it seemed like it was kind of a twofold element of observing the important things they were doing for their health, and I'm sure there were other things too. But then
Hmm.
also getting to know their culture and realizing how important to them proper breathing was, and how much they took in that the importance of that.
So you mentioned a few kind of key health indicators that he noticed. What is now that we've had a few more 100 years worth of observation and some actual studies on the matter? Like, what are some of the downsides of poor breathing?
Yeah, you'd be surprised because how breathing, we just think about it is a very okay, we just need to get the oxygen in, oxygen out. But there really is a lot to be said for proper breathing techniques. And when we're not breathing properly, it can trigger things like dental problems,
Mm.
oral or even facial deformities, cardiovascular problems, asthma, obesity, insomnia, fatigue, anxiety, depression, and even cognitive problems. So the list kind of goes on. Breathing improperly can really cause a lot of harmful issues.
So is there a well sort of understood way of categorizing between what might be harmful versus helpful breathing?
Well, when I think about harmful versus helpful breathing, I think there's probably one secret that is more important than anything else. And so let's just get right into
This is
that.
the, this is the big takeaway, everybody.
Yes. And so, drum roll, please. If you want to do harmful breathing, breathe through your mouth.
Mm.
Okay. If you want to do healthy breathing, breathe through your nose. I mean, that if you don't take anything else from this podcast, that is really the most important thing from the message today. Uh, in fact, mouth breathing can cause so many different problems, and we're going to get into some of that. But it really often comes naturally. But just remember, mouths are for eating and talking. Some of us talk a little too much, but and noses are for breathing and smelling. Okay, so just remember that.
See what I hear maybe some of the members in the audience saying, but they're only maybe half an inch away from each other. Like, why? What's the big deal? Why the difference?
Well, there's so many different problems that come with mouth breathing, and just to touch on it real quick, there are actually a lot of people that do uh, identify themselves as mouth breathers. One study, for example, showed about 60% of individuals in America identify themselves, so over
Mm,
half. And this actually impacted the quality of sleep nearly as much as stress,
wow.
the mouth breathing element. And then there was a study done in Brazil that showed that over 50% of the children there were also mouth breathers as well. And what we find is that when you breathe through the mouth, it literally will start changing the conformation of your face. And so, particularly in children, dentists have noticed that you start developing dental deformities and malocclusion. And so, it will much more likely require braces. And then the jaw will literally start to recede back when you're doing mouth breathing versus nasal breathing. Because what happens when you're breathing through your nose is that, so you take a deep breath through your nose, and it creates a bit of a vacuum, if you will, in the back of your throat and in your lungs. And so this creates this negative pressure effect on the back of your throat. And so that negative pressure effect will allow the tissues in your mouth, or in the back of your throat, I should say, to remain more taut.
Mm.
And that is good. It's good for tissue turgor. So it allows the tissues to be where they're supposed to be. Whereas if you're breathing through your mouth, you're not having that sort of negative pressure experience, if you will, in your throat and in your pharynx. And so what happens there is that the soft tissues of your palate and everything, it tends to start relaxing and collapsing. And so what is that going to do? Well, it's going to set the stage for, again, malocclusion, et cetera, but also for your throat to not be open enough to get that air in properly. And then we start thinking about even things like sleep apnea and that sort of thing, because if you're breathing through your mouth, your soft tissues are collapsing, then you're going to be more likely for the airway to be small and then have those apneic, the stop breathing while you're sleeping.
I noticed in your notes you have a picture here of a girl who developed some, or I should say, became a mouth breather after a little while, and the picture is quite stark between the
Yes.
two, where there's changes in the face, there's changes in the teeth. Can you maybe describe a little bit of that for us so that the audience can get that imagery in their mind as to what exactly is happening, both aesthetically and functionally, for those that are mouth breathing over long periods of time?
Yeah. So basically, what you start developing is more of a receding chin, like I mentioned, a more of a narrow face. And it often does even go along with bad posture, smaller airway, tired eyes,
Mm.
crooked nose. And so, again, when you breathe through that, through your mouth, it weakens the soft tissue in the back of the throat. It flexes inward, and you develop this high arched palate because of that. And because you're breathing through your mouth, you're not really using your nose space much, so your nose space actually gets smaller. And then that all of those changes will lead to the dental malocclusion. Whereas again, when you breathe through your nose, it forces that air against the back of the throat, tones the tissues, makes the airways in your nose and even in your throat wider and breathing easier. You have more of a broad mouth, more prominent chin, straighter teeth, better posture, feel more alert
Yeah.
because you're getting better oxygenated, et cetera.
So it kind of, it's intriguing to me for something that is so healthful versus harmful. When we're discussing proper technique of breathing, that so many people, like in that study, 60% of Americans, or 54% of children, are doing something seemingly naturally, right? Intrinsically, that isn't necessarily good for them. What are some of the reasons why people would become predominantly mouth breathers?
Well, I think it's a lot of times just easier. I
Mm,
think as human beings, we're naturally lazy. Breathing through the mouth, it's a bigger hole, if you will.
yeah,
And, of course, if you get a little cold or something, you're more apt to do it. And then as a kid, it's maybe easier to just continue breathing through your mouth. So there does, just like with the Native Americans, there was a certain amount of intentionality that needed to take place in training, their children. And I think what's easiest is not always what's best for us. And so I think sometimes it can be easier just to breathe through our mouths, even when we're exercising, right? And we're gasping for air. The natural thing is to open our mouth.
yeah.
But we're going to get to that a little later. That's doing ourselves no
Disservice.
favor
Yeah.
in actually breathing through our mouths, because we can get our tissues better oxygenated even when we're exercising by breathing through our nose.
I'm also kind of, as I'm thinking about it, I'm also considering like other potential lifestyle factors.
Hmm.
The obvious ones being things like allergies or deviated septum
Yes.
that need to be taken care of. But even I could see how, maybe like a child growing up on hyperpalatable foods, very processed foods, how the lack of, say, chewing and development of the jaw could lead to poor breathing, which then leads to poor jaw formation, and therefore poor breathing, and
Hmm.
round we go. So there's probably some additional lifestyle factors, I
I
assume.
think there are, because research does really show that proper chewing, which often it's easier to chew properly when you're eating foods that are high in fiber versus
Hmm.
the low fiber processed foods. This does increase the jaw volume, and also even the maxilla. So the middle of the face is primarily the maxillary process and bone, and so that will increase the amount of bony structure in those areas if we're chewing properly. And then again, of course, it will make it easier to breathe properly. So I think you're right. Those factors do tend to reinforce each other.
Was there anything else you wanted to mention about some of the problems associated with mouth breathing or the benefits that we see with nasal breathing?
Yeah, there's a few other things to really consider. When we do breathe through the mouth, we can get more dehydrated because
Mm.
we lose about 40% more water breathing through the mouth versus breathing through the nose. And then again, if we're not breathing properly through the nose while we're sleeping, this can increase the likelihood of sleep apnea, which I did mention earlier. But I can't overestimate or overstate the importance of good quality sleep. And so when we're not breathing properly while we're sleeping, especially if there's an element of snoring and especially sleep apnea, that is going to be huge for both our physical and our mental health.
Yeah.
And so again, mouth breathing definitely can increase that. And then also, even blood pressure problems, mood disorders, and learning disabilities can be secondary to mouth breathing. So, studies actually, there was one Japanese study that showed with rats who got their noses plugged developed fewer brain cells. And so
Mm.
their cognitive
Wow.
ability was significantly impaired, and it took them twice as long to make it through a maze. And so that's pretty amazing data, isn't it? Ha ha
Nice.
ha. But you can just see even from a cognitive standpoint, the mouth versus nasal breathing is very important. And there was a human study that showed that the ADHD risk seems to be higher with people that are mouth breathers versus nasal breathers.
And I heard there's some impressive. There's a particular uh, or not compound or molecule that is involved in nasal breathing that does also make it somewhat unique. Could you explain a little bit of that?
Absolutely. So nitric oxide is a really important compound that naturally occurs in our bodies, and what it does is it improves the blood flow, and it really helps with oxygenation of the tissue. Also helps with immune function and even sexual function. In fact, medications like Viagra and Cialis, they're
Yeah.
really the goal is to kind of increase the nitric oxide available for that sexual function. But one of the easiest ways to do that is actually through nasal breathing. And so when you breathe through the nose, you're going to get significantly more nitric oxide being released into the vascular system, which means that your blood vessels are going to dilate
Hmm.
and you're going to be able to absorb oxygen more readily. You're going to your gas exchange, with the air is going to be better, and your overall health because of the oxygenation of the tissue, and again the immune function, sexual function, etc., is going to be better.
So another group of individuals that tend to be focused on nitric oxide production is that of like bodybuilders and athletes.
Hmm.
And so there's a lot of supplements out there to help with boosting nitric oxide. So can you talk a little bit on how athletes might benefit from this? Especially, I'm thinking if you're working out really hard, nasal breathing, especially as a cross country runner, it was often hard to keep my mouth closed, right? Just because of the exertion. So could you talk about some of the benefits as it relates to exercise and proper breathing?
Yeah. So one study that I think would point to this is Dr. John Douillard. He was a trainer that trained elite athletes, and he wanted to see if there was a difference in as he trained these individuals between mouth breathing and nasal breathing. And so he had them on a bicycle, and I believe it was a stationary bicycle. And what he found was that when they were breathing through their mouths, that their breathing got heavier and heavier, and they were exerting themselves more and more. But he found some very fascinating, uh, drastic change when he had them breathe through their noses, what he found was that as the intensity of the exercise increased with nasal breathing, the rate of breathing actually decreased. And nasal breathing compared to mouth breathing actually cut the overall exertion in half. And so what he found was that nasal breathing really was keeping these individuals more in aerobic respiration instead of anaerobic respiration, and essentially making the respiratory process more efficient. And this in turn led to, of course, less exertion, but then also being less prone to injury. So even though I agree, I mean, since I switched from mouth breathing to nasal breathing running, it definitely at first was very uncomfortable and I felt like I was almost suffocating.
Hmm.
But I realized like once I got, it was almost like this mental hurdle that you have to get over. And after a few minutes of just, okay, I'm just going to stay calm, not panic here, because I feel like and maybe I need to slow it down a little bit, with my stride or whatever. But pretty soon I felt like, yeah, my breathing actually did start slowing down a bit rather than speeding up like it used to. And then I felt more energized and able to run in the, faster and longer, basically.
Yeah, I sort of realized that from running cross country and just the running that I've done since as well, that nasal breathing did seem to promote that idea of the runner's high.
Hmm.
When I was breathing through my mouth, I never really could achieve it. But as soon as I started breathing through my nose, it became much more easily achievable. Now, one other topic that I specifically remember during a song and story in which you asked me to discuss this in front of the entire audience, and I know you sort of did it in jest or whatnot. And I don't know if you were really like a skeptic at that time or you just thought it was silly, but I noticed you put here on your notes a technique that I've been using for a while.
Yes, we want to hear the personal testimony, please.
So the idea is mouth taping. So what is mouth taping and why might somebody do that?
So, mouth taping is something where you literally tape your mouth shut, not just so you stop talking or get your kids to stop talking, but because you want to cut down or eliminate mouth breathing while you
Hmm.
have your mouth taped shut. And there's anecdotal reports of cured ADHD, but the biggest evidence that we've really seen from the research is, as far as benefits, is the improvement in sleep. Now, there are, of
Yeah.
course, athletes that will literally tape their mouths shut while they're exercising to help them remember
Hmm.
to keep their mouths shut and do that nasal breathing. But they've done studies on people that have obstructive sleep apnea and then tape their mouth shut. And because of what we discussed before with opening up that airway and whatnot, it for many people, it significantly improves their obstructive sleep apnea symptoms. And so this could be a really good alternative treatment in patients with mild and maybe even moderate obstructive sleep apnea before turning to a CPAP or surgical intervention. And so in one study, for example, they found that it reduced the apnea, hypopnea index and snoring index by about half when they were
Wow.
doing that mouth taping. But yeah, I mean, if you want to share your testimony about mouth taping, I have to admit, I have actually mouth tape at home, but I guess I've been lazy. I haven't, or maybe a little scared to try it. But
Wait,
you've
you still
tried it.
haven't done
No,
it?
I still haven't done it.
Oh,
So tell me about what it's actually like.
so the type of tape is important. I know probably the audience can imagine we're duct tape around your full head. That's not what we're advocating here. Usually, you're going to use a type of surgical tape. Usually, I've seen like 3M surgical tape. It's got an hopefully you can find something that's going to be sticky enough that it stays on all night, but not so sticky that it doesn't easily come off if you, for whatever reason, need to take a big breath out of your mouth through the night. So you usually just place a small piece over your lips as a disincentive to breathe through your mouth during the night. And this is something that I've used a number of times. However, I don't actually tend to be a mouth breather while I sleep. And so I have not I don't think personally benefited from as much from it as much. However, my wife is somebody that naturally breathes through her mouth every single night. Whether she's got allergies or sickness or whatnot, it's just how she breathes, and so she actually uses it every night as well, and she swears by it. She's it took her a little while to find the right tape for her skin, but once she was able to find that, she's been very happy with it. And so our next technique, though, is something that I do actually use far more often these days, and that's actually nasal strips. So, have you gotten to use nasal strips, Doctor
No,
Binus?
no, I
No,
haven't.
not at all.
But yeah, nasal strips are one of those things that can significantly help a nasal obstruction and snoring. And some people even like internal nasal dilators,
Hmm.
which can do similar things, although some people find even greater improvement in snoring compared to nasal strips. So, and some people will even use both. I don't know about the nasal strips with the nasal dilators, but the
I've tried
mouth.
it.
Yeah, have you really? Wow.
Yeah.
Okay, this guy's above and beyond, right? And then the mouth taping on top of that.
Yep.
All right. So there, and I hopefully you have a picture to prove it.
I do not, but I knew you would appreciate it if I did. I remember thinking when I had it that Dr. Binus would have liked to see that. But I don't personally use the dilator anymore. I like the nasal strips. That seems to work well for me. My wife, however, though, she actually uses the dilator with the mouth tape. The nasal strips for her skin, it was causing issues with that. I think it's a matter of personal preference and what works for you.
Yeah. And so these are great natural ways that are not much less intrusive, invasive than getting like a CPAP or, surgery. Sometimes people get, there's all sorts of different things that, people are trying, but these are low cost and they are often very effective for people, both for snoring and then the mild to maybe even moderate sleep apnea.
So, Dr. Binus, I've heard that our nose actually has cycles. Can you briefly just touch on what that means?
Well, what that basically means is that we are the interior of our nose is actually covered in erectile tissue, and so
Dr. Binus, keep it PG, please.
yes, yes. Don't worry. So the nose, we tend to breathe in one nostril or the other, and it alternates. So our nostrils basically take turns opening and closing, and what's interesting is that we find that if you're breathing more through the right nostril, this tends to activate more.
Mm.
So if your body or your brain feels like you need to be more activated, then it would tend to open up that right nostril. On the other hand, if your brain is saying, okay, we need to chill out a bit, then your left nostril would tend to open up, and that is more calming. And so you can pay attention to this, and you'll notice that, okay, well, yeah, my right nostril is maybe more open, my left nostrils. And what's interesting is some people tend to be a little more left nostril dominant, and others more right nostril dominant.
Yeah, that is interesting. An easy way I saw Dr. Patrick McKeown. Actually, I don't know if he's a doctor, but I saw him make a recommendation to determine that. Easy thing, you take your phone and then you just breathe on it on the screen real
Hmm.
quick. And then from the moisture, I guess, right, you'll be able to see maybe which one you're breathing out of a little bit more
Yeah.
naturally. But I know there was an interesting case study with a particular psychiatric illness. Did you want to talk about that?
Sure. So there was a case study on a woman who had schizophrenia, and this individual had significantly greater left nostril dominance. And when you think about that, what's interesting there is that the left nostril is going to tend to be more activating to the right side of the brain. And a lot of times that can actually perpetuate when there's greater right sided brain activity, could potentiate or worsen hallucinations.
Mm.
And so they taught this individual to breathe more through the right nostril, which then in turn activated the left brain more. And what they found was that she experienced significantly greater hallucinations after she was taught to do more right nostril breathing.
Yeah, reduction in hallucinations,
Yes,
you mean? Okay.
significantly. Okay, yes, that's what I meant if I didn't say that.
So, Dr. Binus, often when people come to see a therapist, they'll usually be given like an exercise called diaphragmatic breathing. Now, I realize that often the diaphragm in breathing is underutilized. Can you tell us a little bit about that?
Yeah, it's pretty amazing when you realize that lung capacity is really important, and a lot of what has to do with lung capacity is diaphragmatic breathing. Actually, when you look at the Framingham Heart Study, which is one of the longest running studies ever done on looking at cardiovascular risk factors, they found that the greatest indicator of lifespan was lung capacity.
Well,
And so, again, we see lung capacity is very important for general health. It's also important for mental health as well. And the good news is we can actually increase our lung capacity. You can see that with free divers, for example, that dive very deep into the ocean. They're able to, with practice, dive deeper and deeper, hold their breath longer and longer, and oftentimes get to the point where some of these guys are almost double the average lung capacity of individuals. So certain ways of breathing can help us to expand our lung capacity. And a big element there is actually learning to utilize our diaphragm. And essentially what we want to do is really learn how to breathe in deeply, and then not only breathe in deeply, but then also exhale well, so that we're getting more movement of the diaphragm. I mean, the diaphragm's what we call an involuntary muscle, right?
hmm.
But we can train it to become to expand more, to go down more as we inhale, and then as we exhale properly, it will come up further. And over time, as you train yourself to do that, and you're intentional with the proper breathing technique of having, good posture, and then taking those deeper breaths through your nose, slower in, and then out as well, making sure you're exhaling well, then you're actually helping the diaphragmatic excursion, if you will.
So you mentioned deep breathing. I think I heard you also mention slow breathing
Hmm.
in there as well. Can you talk a little bit about the differences between that and why we need to focus on those two things?
On both, yeah.
Yeah.
So, with the deep breathing and then the good exhalation, then we're really helping our lung capacity. We're helping the diaphragm to move properly. We're allowing more airway exchange because when we are expanding our lungs, then there's going to be more surface area in our lungs with the alveoli, which are the areas where the gas, actually the air exchanges and the gas exchange takes place. So there's more of that. But the slow element is also important. And what's interesting there is that we often just think of air and we think of oxygen, right? We think, okay, I just need to get as much oxygen as possible. And oxygen obviously is the most important. Without oxygen, we're going to die. But the misunderstood gas is carbon dioxide. So, carbon dioxide we often think of as kind of waste gas, like we don't need it. Who cares about carbon dioxide? We want to actually get our levels down. But the truth is, we don't want carbon dioxide levels too low. And if we're breathing rapidly, then we can, like hyperventilation, for example, we can get our carbon dioxide levels too low. And if you think about hyperventilation, I mean, some of us have probably recognized if you hyperventilate enough, you get pretty dizzy and you can even
hmm.
pass out, right? So that's
hmm.
just an example of where the CO2 can get really way too low. But what we find is when it comes to delivering oxygen to the tissues, that a certain amount of carbon dioxide is helpful to unloading the oxygen from the red blood cells to the tissues. So basically, if you have more carbon dioxide There's this thing called the Bohr effect. And so what we find is when we have more carbon dioxide, that the red blood cells hang on to oxygen less tightly.
Hmm.
And so having a higher amount of carbon dioxide in your bloodstream then will allow your red blood cells to deliver the oxygen to the tissues more efficiently.
Mm.
And you want that. And so again, slowing down your breathing will in turn increase the carbon dioxide content in your blood, which in turn will allow the oxygen delivery to your tissues to improve, which will then help your athletic performance as well as just your general physical and mental performance.
Yeah, when we talk about that in the context of mental performance, my immediate thought is like a panic attack.
Hmm.
And, often there's very shallow, rapid breathing in the midst of a panic attack. And so, can you maybe walk us through how carbon dioxide and oxygen may play a role in the midst of a panic attack?
Yeah, so when we take those longer, slower breaths, this actually increases blood flow to the brain. So when you're doing the shallow, rapid breathing, that actually can constrict blood flow to the brain, and of course, that's going to make your brain cells panic even more,
Mm-hmm.
and make you feel even worse. And this, in turn, will just perpetuate, because then when you feel more panic, then usually it leads to more hyperventilation, and then people can often really panic. Versus when you slow it down, you bring up those CO2 levels, you get better oxygen delivery to your brain cells, and better blood flow to the brain. Then you're going to be able to calm down more. You're going to enhance the parasympathetic nervous system, and you're going to feel calmer.
Yeah, it's very interesting. Remember the whole brown paper bag thing that used to be kind of
Yeah.
the common thing? And the interesting thing enough with that was that the primary reason it was recommended was to get CO2
Hmm.
back in, right?
Hmm.
Because as you're exhaling it, you're exhaling too much,
Yeah.
which then tricks your brain into thinking you need more air when in reality you need more
Yes,
CO2,
right. And you need to
right?
slow it down.
Exactly. So we don't typically recommend brown paper bags anymore because you're not breathing in oxygen, which you need as well, right? But it is, I think, counterintuitive for a lot of people.
Right. So the basic take-home message is there. We want to take deep, slow breaths. So slow
Using
it
the
down,
diaphragm,
use the
right?
diaphragm, and breathe deeply.
So there's something about I, ions when it comes to breathing. I'm not entirely sure I understand this concept. So could you enlighten me, Dr.
Sure.
Binus?
So when we talk about air, one other aspect that we want to talk about is the quality of air. So, what's interesting is that water interfacing with air makes it fresh. So, air near oceans, forests, especially evergreen forests, rivers, and waterfalls, and air after a rainstorm, all of those are going to make the air more fresh. And what do I mean by fresh? Well, part of that is it does cut down on pollutants. For example, air from the mid Pacific contains about 15,000 particles of pollutants per inch, versus air from big cities contains about 5 million
Wow.
particles per cubic inch. And so it helps to clean the air. But another big, really important element is what you we're referring to, which is ionization status. So fresh, healthy air may contain 5 to 10 times more negative ions in it. And what do negative ions do? Well, negative ions actually help to increase serotonin, give an improved sense of well-being and decreased anxiety, better concentration and learning, and can enhance the immune system and lower the body temperature and resting heart rate. Whereas positive ions, on the other hand, can trigger headaches, dizziness, nausea, and fatigue. So again, being in that clean air, that air that is close to rivers or some kind of large water source, and then also in forests, is very healthy.
Awesome. And so everything that we've talked about today, I've definitely found very interesting. But for both my sake and the sake of our listeners, what sort of practical takeaways, or do you have any techniques that you would like to discuss with us?
Yeah, there's a couple techniques that are very commonly used. One, and I'll just mention two main ones. One is resonant, or what they call coherent breathing, and essentially, some researchers believe that this is really what allows our body to kind of be most in sync, and that's why they call it coherent breathing. And essentially, it's about 5.5 seconds in, 5.5 seconds out, for a total of 5.5 breaths per minute. So basically, it's taking nice, deep, slow breaths at 5.5 breaths per minute.
Hmm.
And what they found is that this can rewire vagal tone. In other words, it can actually really bring the calm, the parasympathetic nervous system online, and allow your body to feel more calm. And it purportedly helps the heart, circulation, and nervous system to coordinate at peak efficiency. And again, that's why they call it the coherence breathing. Another common breathing style or practice is one that Navy SEALs use to stay calm and focused. And they call that box breathing. And so in box breathing, it's 4 by 4 by 4 by 4. So in for 4, hold it 4, out for 4, and then hold it 4, and just repeat. So basically, you're just doing 4 seconds in, holding it for 4, out 4 seconds, and then holding it for 4. Now, if you want to get more of a parasympathetic response to really for that calming effect, their variation here is breathe in for 4 seconds. And again, remember to breathe in through your nose, right? And then hold it for 4 seconds, then out for 6, and then hold it for 2, and then repeat. By the way, some people often wonder, like, okay, so do I breathe in my nose and out my mouth? There's not a lot of strong evidence one way or another. Like, is it okay to breathe out of your mouth versus breathing out of your nose? Probably not a big deal. I find for myself, like with exercise, for example, that it's just easier to keep my mouth shut. Otherwise, I get confused. Like, am I supposed to breathe mouth open or not right now? The other thing is, when you do breathe out of your nose, it does tend to slow everything down a little bit. So again, that helps to maintain adequate carbon dioxide levels as well. So in general, I think not a bad idea to probably do in and out through the nose, but not a huge deal if you're doing out of the mouth.
Makes sense.
So that's a couple of practical tips. And by the way, there's some really cool, if anyone wants to look up, there's this program that has been developed called Sky Breathing, where essentially it's 6-day-a-week breathing course, if you will. And they have done a lot of studies. And so it's just a breathing class where people come and they do 23 minutes, 6 days a week. And then actually once a week, they do 50 to 60 minutes. And so during this breathing class, they've shown some incredible outcomes, reduced anxiety, improved less depression, improved PTSD, and better sleep, better optimism, decreased stress, better antioxidants, and more alertness and focus. And so again, there's just a lot of evidence that's showing now the importance of good breathing and how it can actually be an incredible intervention even when someone's struggling with mental health problems. And the last thing I want to mention is that you can also, if you really want to get that nitric oxide up, one great way to do it, it might annoy people around you, is humming, actually. So, yeah. So doing humming will increase your nitric oxide by about 15-fold. And ideally, you want to practice that about 5 minutes a day.
Excellent. Well, I imagine that many of you may be listening to this in the car. And if you're driving by yourself, then that would be a perfect time for you to hum along with one of your songs after you finish listening to this episode, of course. We want to thank you all for listening. We hope you found the content in this podcast both, interesting, but also practical. And we hope that as you go about, you take some nice, deep, and slow breaths.
Through your nose. So shut your mouth.
And we'll see you again next time.
Thanks for listening. To hear more episodes, find us on social media, or support us financially, visit thebrainpeoplepodcast.com.